Hello, everybody, and welcome to another live webinar, mini webinar. I guess it depends on how long I talk for, if it's a mini or full on webinar. And today is all about lifestyle approaches to help improve the quality of your sleep. So, what are lifestyle approaches? And the framework I'm using for this talk today is from the American College of Lifestyle Medicine. And I don't know if you knew there was actually an American College of Lifestyle Medicine, but it's a group of physicians that got together and basically decided there are things that we can teach our patients to help improve the quality of their life and health without really needing to rely so much on medication, because a lot of what we do in sort of the Western medical world is more sick care, acute care. You break your arm, you go to the hospital, you get surgery, you have cancer, right? Being on chemo and surgery. And certainly those things are super, super helpful. But what are the things that we can do to keep your muscles strong, keep your balance intact, so you're less likely to fall and break your arm or less likely to develop cancer if at all possible? And according to the American College of Lifestyle Medicine, ACLM, they use 6 pillars. And these 6 pillars are sleep. And I'm going to start off with sleep because I'm a sleep doctor and I'm super biased. Healthful eating. And the dietary recommendations they include are a whole food plant-based diet, increase physical activity. We got to move our body, develop strategies to manage stress. Stress can be really detrimental for our health. And, I always like to encourage my patients is that as we get older, we can actually have more and more stressful events come, but it doesn't necessarily have to bother us as much as we think it is, right? Because you can actually learn how to control your emotions. Avoid risky substances, tobacco and alcohol. I can go a little bit into that later as well, how it interacts with our sleep. And then form and maintain relationships. The community that you have is also really important. So those are the 6 pillars. So eat plants, keep moving, sleep well, be present, manage your stress, stay calm, and love people. Really nice framework. Okay, so talking a little bit about how important sleep is, I think we still have these ideas sort of swirling around in our culture that sleep is sort of something that we do when we're retired, or when we have more time, when we get around to it. But I really want to encourage you to sort of shift that framework of your thinking. Why? Because sleep is so important. It's as important as drinking water, getting fresh air, breathing oxygen, right? Eating healthy meals. Because if you shortchange yourself on sleep, right, you're tired, your brain doesn't function as well. It's actually harder to maintain your health. Why? Because you're so tired and you don't have enough energy, right? And I think energy is something that we all probably want more of, right? So sleep is really vital for life. And let's dive right in to talk about the different lifestyle factors. So, the first one I want to talk about is something that I probably already talked about, is food and sleep. I know there is another YouTube live where I talked about this, so I'll keep it brief. But in short, what you eat also impacts how you sleep. And that can go down to the macronutrients, how much carbohydrates, how much protein you're intaking, how much fiber. So, following a whole food, plant based diet actually can help you have better quality sleep. Why is that? Well, I mean, sugar tastes really good. And I think something commonly we are, and I'm not sure why, at night we're sort of taught that milk and cookies is a good evening snack to help us relax. But actually, the sugar is not good. I mean, sugar tastes good, but it's not really good for your body in terms of your sleep as well. It's associated with more arousal, so waking up more frequently at night. Certainly, if you are someone who gets hungry in the middle of the night, probably is okay depending on what time that you eat dinner. I usually eat dinner a little bit early because I do have young kids, so having some nuts around 8:39 is probably okay, because otherwise I don't eat until like 8 o'clock the next morning. And that's from like, 6 o'clock p.m. to 8 o'clock a.m. That's a lot of time. So having an evening snack that's associated with more fiber is actually helpful to keep you in more of a deep stage of sleep. And always a plug for kiwi fruit. My last talk, I did mention kiwi fruit, and I know some of you have emailed me, sent me messages saying, "Oh, Dr. Val, I actually tried kiwi fruit and it did help." So, again, to review this study for those of you who haven't listened, eating 2 kiwis an hour before bedtime for about a month resulted in folks who were participating in this study to fall asleep faster, sleep longer, and report better quality sleep. And this study was done in Taiwan. So, really, really cool things there. Um, and then if you have a diet with more saturated fat, right? So going back to the milk and cookies, milk has a lot of saturated fat. It's an animal product, more awakenings at night and less deep sleep. And we want to have enough deep sleep. Why? Because deep sleep is the time of the night. Well, we feel more refreshed, we feel more energized, and it's when our glymphatic system gets activated. The glymphatic system are the trash collectors of the brain. So throughout the day, we actually build up these toxins, and when we sleep the toxins get cleaned out, right? And so you want to make sure that your trash bins get taken away, the trash bins of your brain, and that happens during deep sleep. Something else to note, if you are someone who has restless leg syndrome, and this can happen more frequently in women, especially in and around pregnancy, it's actually associated with decreased levels of iron in your brain. It can also be genetic. Restless legs is described as an urge to move your legs, gets worse with rest, gets worse in the evening time, and feels better when you wiggle them around, right? Sometimes I've had some patients who have contacted me in clinic, and I've done some consults, and they really cannot fall asleep for hours, I kid you not, because their legs bother them so much. So, one of the first things we do is we actually check a ferritin, which is the storage protein for iron, and then some iron studies to see what their iron levels are, their percent saturations, total iron binding capacity. And if those are low, then we encourage them to eat more iron. Guess what? You can get a lot of iron from foods, right? So, what are food sources of iron? Well, fortified cereals, beans, dark chocolate, lentils, spinach, potatoes, nuts, meat as well, right? Liver, if you like to eat liver is a lot of iron. But if we're following the lifestyle medicine, we know we definitely recommend more of a whole food plant based diet. So, that's how restless leg syndrome can be impacted by the kind of foods that you eat. Another sleep condition is called narcolepsy, and that's a condition where people are tired all the time. I don't believe there's an increased prevalence in women. Typically, there's an increased prevalence in younger people. So, this is a condition where, regardless of how much sleep you're getting, you're still pretty tired. Some people that I've seen who've had this can sleep 10, 12, even 15 hours and still feel really exhausted. And it has to do with the disruption in their sleep stages. Not a lot of research on this, but having less carbohydrates in your diet and also more of a ketogenic diet has been associated with improvements in their daytime sleepiness. So, this study only had 9 participants, but something to be sort of mindful of, right? What you're eating, right? Is it heavy laden with carbohydrates or processed food? Is that making you feel sluggish and decrease in energy? Just some food for thought. Okay, so that was our first pillar. We talked about food. The next one that I want to talk about is stress reduction, right? I think we probably all know about how much stress can impact our sleep, but I don't think we're always aware of how much it really does. And what do I mean by that? I think we all probably have some levels of stress that go up and down throughout the day, throughout the week, throughout the months or years. And, it's really interesting because when I see some folks in my clinic who have insomnia, they're not always able to come up with a specific trigger of what caused them to have some disruption in sleep. Sometimes it was a medical condition where they were hospitalized, and ever since then, they really had a hard time sleeping. Sometimes some people just don't really know. And I think there needs to be a little bit of self awareness around your emotional state. And I spoke with a really good therapist recently, and I sort of asked her, well, how do you help your patients who have a hard time sleeping, whether it be insomnia, to really understand how stress plays a role on their emotions and emotions and sleep. And she says, there's a lot of good standardized questionnaires. So there's questionnaires about depression, there's questionnaires about anxiety. And if your emotional state isn't something that you've talked about pretty regularly, or if you don't read a lot of self-help books, or if you don't delve into it, it's almost like you don't know what you don't know. And so one of my favorite things to teach people is that sleep happens when your brain waves slow down. So if you do have an undiagnosed or untreated anxiety condition, trauma condition, depression condition, that can really impact your sleep. And it's bi-directional, meaning if you're not getting good quality sleep, it can make those conditions worse. And those conditions, if untreated, can impact your sleep. So, really important to make sure that if you do have a lot of stress and if you do suffer from anxiety, depression, PTSD, make sure you talk to a healthcare professional about that. And always, as a disclaimer here, even though I am a medical doctor, the information provided here is just for education alone. Yeah. And I'm just happy to provide this education for free for the women of the world because there's a lot of not useful information out there, and I want to make sure that people are getting the things that they need to know to help improve the quality of the life that they want to have. Yeah, so that's all about stress. And some of my favorite tools to help improve stress are mind body practices. So, mindfulness, breathing exercises, journaling, being in nature are really fantastic things. Avoid risky substances. So, when you take a look at one of the other pillars of the American College of Lifestyle Medicine, it's avoiding risky substances. So, there's a lot of information now that we know about alcohol and how it doesn't really help our health in terms of cancer risk, especially for women. Canada actually decreased the amount of their recommended drinks per week for folks, which is pretty interesting. So, how does alcohol impact our sleep? Well, it can actually help us fall asleep faster, right? Depending on how much you drink. I'm sure if you do drink or be around people who drink, they do fall asleep, can fall asleep fast, but it actually disrupts our sleep stages, namely our REM. And so it can actually suppress REM or decrease REM. And in one study, over 11,000 people, it was associated with poor sleep quality and snoring. So, how is snoring and alcohol related? Well, when you drink alcohol, it helps you relax more, your mind, even your muscles. And so, when your muscles are relaxing more, specifically the tongue, that can lead to more issues with snoring and potentially even sleep apnea. So, something to really mindful. And sleep apnea definitely can disrupt the quality of sleep that you're having, right? Because you're not breathing well. The other risky substance to consider is caffeine. Now, caffeine is really the most commonly used stimulant, but it really can impact your sleep. The why it does this is because it blocks the adenosine receptors, and basically, adenosine is a protein in your body. When it builds up, the more adenosine we have, the sleepier we get. So when we block that, ideally we have more energy or less sleepy or less aroused. Most people, I would say caffeine, the half-life, meaning it gets out of your system about 5 hours, but can range between 1.5 to 9.5. For me, I'm super sensitive to caffeine. I pretty much stick with teas now because it has lower levels of caffeine, but I do really like a good vanilla latte every now and then. Yeah, so that's avoiding risky substances. So we talked about food, we talked about stress, we avoid risky substances. What else can we talk about? Well, exercise, moving our bodies. Um, I don't know if you know how much I need to talk about this, but I'm sure, someone who's gone on like a hike all day or done running, right? That you feel really tired, right? When your body feels tired, it's easier for your mind to feel tired. There's a really interesting research study that was published in 2016 where they had women in Iran use a pedometer. So basically, a pedometer is just something that monitors how many steps you're taking. They took a look at 112 women after they're in menopause, postmenopausal, and they just encouraged them to walk more. So 500 steps each week, which is about a quarter of a mile, to a maximum amount about 5 miles a day, right? So they were trying to increase the step count to about 10,000 steps, which is sort of what we recommend here in the US as well, by the end of 12 weeks. So interesting. Like, can you really go from like barely walking to walking almost 5 miles a day? And guess what? Yes, I think it's definitely doable. And at the same time, compared to people who didn't increase their walking, the group who did walk more fell asleep faster, slept longer, and had less sleep disturbances. Even better yet, they used less sleep medications. I'll repeat that. Compared to people who walked more, you know, not everyone met the 10,000 steps, but Those who just basically started moving their bodies more fell asleep faster, slept longer, had less sleep disturbances at night, so probably woke up less. And then they also used less sleeping medications. And sleeping medications definitely do have their time and place. Chronic use, I definitely don't recommend, especially as you get older. But how amazing is an intervention like walking? And it's, you know, pretty accessible ideally to most people. Go to a park. If it's not safe, can you just walk around your house, just pace around, find a friend to walk with, right? And that goes to the next one, building community, having a support system. If you ever heard the saying, you're a sum of the five people that you spend most of the time with. I had a patient once who had pretty bad anxiety. She had a little bit of agoraphobia, fear of the marketplace as well. And when she did go out, this is pre-pandemic, she would be around people who were a little bit more negative. And also they had insomnia and they also had difficulty sleeping. So I encouraged her to basically find people who are less negative, right? People who are more interested in their health, I think, and wellness. And that definitely helps improve because you are pretty similar to the people you're around. You sort of absorb their energy, they absorb your energy. So if you want to improve the quality of sleep that you have, be around good sleepers. And, the Sleephoria community is definitely like that. You can go ahead and check us out on here on YouTube, definitely at sleephoria.com. We're also on Facebook and Instagram, probably a little bit more active on Instagram. So if you see any of my posts and comment, and more so, the blog is sleephoria.com and our comment sections are open. Please feel free to comment away and build relationships with other women in our community because when we do it together, right, it's always better and it's more fun and we can always learn together, right? So we talked about movement, we talked about avoiding risky substances, we talked about food, we talked about stress. What else haven't we talked about in terms of the six pillars? So let me look at my notes here. Yeah, plants moving, being present, staying calm, managing stress. Yeah, I think the last one is just about sleep. And so that's something that we talk about all the time. But for us, sleep should be really prioritized, right? Because guess what? If you don't get enough sleep, they're certainly harder to go to the market, buy healthy foods, cook healthy meals. You're going to be too tired to move your body, even walk around the house or go to the gym. When you don't get enough sleep, your emotions are really hard to regulate. So it's harder to handle stress. And also, I've had a lot of patients who have insomnia when they don't sleep well. Sometimes it can impact their relationship with their bed partner, right? Because they're tossing and turning. Their bed partner can't sleep, right? Or, their relationships with their kids. I know for myself personally, when I don't get good sleep, I can be a little bit more snappy with my children. Yeah. And then avoiding risky substances. Smoking, I didn't talk too much about, but that certainly can potentially even impact the quality of sleep that you have as well. Yeah. So very good. All righty. So in summary, defining lifestyle medicine, eating plants, moving your body, and it could be simply as walking, sleeping well, being present, staying calm, and loving those around you and yourself. So this was another webinar for Sleephoria.health. And, as always, I wish you a great night's sleep, rest well, sleep well. And really the purpose of Sleephoria, it was founded on the belief that a well-rested woman has the energy, clarity, and drive to change the world. So let's all make the world a better place. Thank you for watching. And if you did watch to the end, please send us an email or comment below, hello@sleephoria.health, and we'll send you a certificate for watching. Thanks. Bye-bye, everyone.